Hi, my name is John Erdmann, and I'm with Erdmann Prosthetics and Orthotics. Today we're going to discuss how to put a TLSO on a patient after surgery. Two functions of the TLSO are to restrict movements and also put compression on the stomach. When a patient is standing or sitting, gravity is pushing straight down on the spine. When you wear a TLSO, we're pushing against the stomach material, which cannot go into the hips, but instead when you push on it, it elevates into the diaphragm. When that happens, the vertebrae will actually elevate or unweight. Gravity is pushing down on the spine, and we want the screws in the vertebrae to ossify at the right angle and not in a compressed position. We want to heal in an elevated position, not a compressed position. So next, we're going to show you how to put the TLSO on. The first thing we're going to do is tuck in the gown. You're going to tuck in the gown on the far side first. Next, we're going to have the patient bend their knees. And we're going to do a log roll, bringing the knees, shoulders, and hips all in one motion to the other side of the bed. Now we're going to organize the gown underneath. We want the gown between the skin and the brace for better comfort. Oftentimes after surgery, you're going to have a drain. The drain typically comes out the side like this. What I want to do is position the drain towards the top of the brace, coming out the top like this. Now we cover the patient up with the gown like that. Take the back piece, and on the back piece there are waist grooves that rest on top of the hips. Find the space between the top of the hip and the ribs. When you locate that, you want these waist grooves to be guided in to that space between the hip and the ribs. Then push the brace underneath the patient. Kind of wiggle it. Once you have it in position, you want to check if it's centered. On the brace, there's a spinal relief that goes down the length of the brace. You want the spine of the patient to be in that channel. So take a look and make sure that you're centered. If you're not, take the brace and just wiggle it slowly, gently, just a little bit at a time until the channel is centered on the spine. Next, we're going to have the patient bring their knees and hips and shoulders back over and lay on their back. The next thing is we're going to see if the brace is centered by checking the lateral sides of the brace to see if they're on the midline of the body. Once you have that in position, we're going to take the top piece and put that on. Now the top piece has an overlap. This plastic here that's exposed is going to overlap the back piece. Next, we're going to get the straps started. Now that the front piece is on and started, I take my left hand and I push against the stomach while I tighten the straps. You start with the middle strap first as it's going to give you the most compression. Next, we're going to tighten the bottom straps. And then finally the top strap. You want to make sure the brace is tight. So you ask the patient, is the brace tight? And if they say yes, good. If they tell you it's difficult to breathe, good. You want enough compression on the stomach to be able to take gravity off of the spine. Now we're going to sit the patient on the side of the bed to get them ready to mobilize. Have the patient bring their shoulders and knees and hips and log roll to the side. Next, we're going to get the legs and feet off the bed by holding on to them like this so there's no twisting. And then you and the patient are going to come up to a sitting position. Now the patient's ready to be mobilized. Now we're going to demonstrate how to put a TLSO on using a smart sheet. Occasionally, you have a patient that is a little bit larger and heavier, and it's difficult to slide the back piece on a patient like that. So to start with, we're going to tuck the gown in like last time. Next, we're going to have the patient bend their knees, and then we're going to log roll to the other side of the bed. Again, we're going to organize the drain so that it goes out the top of the brace. We're going to pull the gown out. Now we're going to apply the slip sheet. You fold the slip sheet in half. You tuck the slip sheet as far under the patient as you can, using your hand as a guide. Now we're ready to put the back piece on. You'll see the waist grooves on the back piece. You want to match those up with the top of the hip and the space between the top of the hip and the ribs. Push the brace underneath. It slides very easily, so you don't have to push too hard. Get the channel of the brace centered on top of the spine. Then you have the patient roll back over onto their back, bringing their knees and hips and shoulders at the same time. Next, you check and make sure that the sides of the brace are on the midline of the body. Then we're going to apply the front piece. All we have to do now is just get the straps started. Okay, straps are in place. I use my left hand to push on the stomach, and starting with the center strap, we pull tight. Next is the bottom strap. And finally, the top strap. Now the brace is on. We need to take the slip sheet out at this point, so let's log roll to the other side and take the slip sheet out from underneath the patient. And then we're going to log roll back onto their back. And then we're going to continue to come towards me. Log rolling towards me. Next, we're going to get the patient to sit by taking the legs off of the bed, hang on to them so that we're not twisting. Use your right hand to guide the patient up to a sitting position. The patient can help you with one arm. So all in one motion, we're going to go to a sitting position. Now the patient's ready to be mobilized.